Coming up, we'll be on location in Towson, Maryland, discussing the latest advances in dental implants and how they can help restore your dental health and give you the smile that you've always desired with one of this region's top oral and maxillofacial surgeons, Dr. Anush John. Dr. John received his DMD degree from Boston University and completed his medical degree from the University of Missouri. Dr. John is widely recognized as one of this area's top doctors. Welcome, Dr. John. It's a pleasure having you on our program.
Thank you, Mr. Rocco.
It's your first time, in fact, on the Top Doctors interviews.
Yes.
We have a lot to talk about, so I'm just going to jump right in, Dr. John.
Okay.
And I'm going to ask you, if I may, to please begin by telling us about some of the latest advances that have taken place in oral surgery in the last few years and how patients are benefiting from them.
In the field of oral surgery in an office-based setting, some of the latest things that have helped us do implants and bone grafts better is better bone graft techniques so that we can put bone graft wherever we need a bone graft in order to place implants. The other thing is better imaging, 3D imaging that helps us to plan the position of these implants much better. In the past, we used to have just the 2D images and we used to have to guess a little bit where the implant had to go. But now with 3D imaging, we can plan to perfection to where exactly an implant goes. And so there is much less guesswork that is needed at the time of the procedure.
Very interesting.
The other thing is there are much more implant companies with different implant sizes so that we can put all kinds of implants in all kinds of bone, in all kinds of areas of the mouth to help the patient.
So basically, Dr. John, through the advances that have taken place in technology, as we always move forward with latest and greatest and advances within technology, certainly the field of dental implants has benefited, like many other specialties within the medical arena, through these advancements. And for the folks out there watching, they've heard you mention dental implants and myself as well. Can you please tell us in a little bit of detail what specifically they are, so folks can understand?
An implant is basically a titanium screw. So when a patient loses a tooth, there is a crown of the tooth and then there's a root of the tooth that's stuck inside the bone. The implant basically is a titanium screw that replaces the root of the tooth. So we screw it into the bone and we let it be there for about 3 or 4 months while it heals. And then they go back to their dentist who makes a crown on top of that root. So that implant, so that titanium screw gives support for the crown of the tooth. And that's essentially what an implant is.
And I understand there are different sizes. There are even mini dental implants available now?
Yes, there are mini dental implants available, and it is used in certain instances. I would not want to use it in every single instance because a mini implant cannot support the biting force. So when I use a mini implant, I use it usually as an interim implant while the rest of the implants are healing up. So for example, if a patient is getting 6 implants on the top, I put 6 implants, and while that is healing up over the next 3 months, I throw in maybe 2 or 4 other mini implants which act like an interim support to help with the denture during the healing period. But the mini implants by themselves, they don't have the physical structure to support a person's biting force.
So they're basically beneficial for what you just described as a bridge, so to speak,
as a bridge, yeah,
until the actual dental implants heal over a few months.
Right. Exactly. That's the way that I use it. Yes.
Now, what types of problems do dental implants address? For folks watching, you know, they want to know if this is something they can benefit from. Can you please tell us?
Anytime a patient has lost a tooth and wants to replace that tooth, that's where a dental implant comes into play. There are usually 4 treatment options anytime a patient loses a tooth. One is not to do anything. But if you don't do anything, it can compromise either on aesthetics if it's a front tooth, or if it's a back tooth, it can compromise your chewing efficiency. The second is to have a denture made. So they'll go to the dentist, the tooth is removed, they will have a denture replacing that one tooth. And the denture is basically a plate that sits on the roof of the mouth or in front of your tongue. And you got to take it out in the morning, take it out at night, put it on in the morning. The third option is to have a bridge made. So you lose one tooth and you have a bridge made across two other teeth on either side. And the fourth option is to have an implant made, which basically replaces that particular tooth with another tooth.
It's a permanent option.
It is a permanent option.
And it's not one that, like with the dentures you just said a moment back, where you take it in and out at night and in the morning. This is something that basically has replaced your missing tooth or missing teeth.
Exactly.
And it's become part of you.
Exactly right. And many times we have patients where we put an implant 10 years ago, and they come back and we ask them which tooth was the implant, and they're not sure which tooth is implant because it's just another tooth for them.
And
They just forget that tooth was the implant. It's just like any other tooth.
So it's just seamlessly integrated itself over time,
Exactly
right? And it looks as the same as the natural teeth that we already had.
Exactly right.
So you can't even tell a few years later in some cases. Now, what are some other additional benefits of the dental implants, Dr. John, say compared to some of the more traditional options? I know you touched on those, but maybe a little bit more in detail, please.
So the four options are not to do anything, a denture, a bridge, and an implant. The problem with a denture is that you got to take it in and out, and you got to care for it separately. And the other main problem with the denture is that the denture sits on the bone and can put pressure on the bone and slowly over time dissolve the bone. So everybody, once they have a tooth removed, the next day onward the bone starts to dissolve, and within the first year you lose 25% of the width of the bone. Now if you put a denture on top of that, that pressure causes that bone to dissolve even more. So if you came back 3 years later, that bone is gone even more, so that it would be harder to put an implant later on.
Okay.
The third option is to have a bridge made, in which if there's a missing tooth in the middle, they cut down a tooth on one side, they cut down a tooth on the other side, and make a bridge that connects this missing tooth with two other teeth. The problem with that particular treatment is that if one of the other teeth have decay underneath the bridge, the whole thing collapses, because it's based on two good teeth on either side. And so we see that a lot, where 10 years after having a bridge made, they can have decay underneath the bridge, causing decay and failure of one tooth. And when that happens, you lose the whole thing.
It all collapses over time.
And so we've had a lot of patients who come back, and we had to now place two implants, one for the old missing tooth and one for the new missing tooth that just failed.
And you realize that in many instances, and I know a lot of you out there watching can probably relate to this, you're eating something like steak or chicken, and the next thing you know, there's the bridge. It suddenly has broken, right?
It's funny that you mentioned chicken, because I had a patient today that broke her tooth when she ate a chicken wing at a Ravens game. So it's it doesn't matter where you are.
Exactly. Now, how do you determine, Dr. John, if a patient needs dental implants when they come into you? Because there are other options, but what's the criteria that you go through the process to determine that?
So of the four options of a missing tooth, some patients can choose not to have anything done. And I've got patients that are 98 years old and not in a healthy position to have implants done. And so for them, the option may be not to do anything. Some other patients, because of financial reasons, they may choose to have dentures made. But there are many patients that come back to us having a denture for 10 years, and now they hate those dentures. because now the bone has become flat and the dentures don't stay.
Yeah.
So they come back to us, and we then put a couple implants or 2 or 4 implants and help the denture to stay better. So if a patient doesn't like their dentures, if a patient's bridge failed and collapsed, then they come back and they have implants done. Or if a patient wants implants from the beginning for functional reasons or for cosmetic reasons, then we'll put an implant in.
I wanted to ask you, Dr. John, for folks out there who, may want to take advantage of the dental implant option and don't know if they're somebody, if they are actually going to be a good candidate. I know you went into some of that already, but from when they come here, okay, to your office or another oral surgeon's for the initial consult, and I'm sure this depends on each particular patient and his or her situation, but in general, what's the timeline that they would be looking at from initial consult to that new smile or that healthy smile where they can chew and eat again normally?
If a patient came today and I did an extraction today, the first thing I do is I take the tooth out, put bone graft in there, and we let that heal for 3 months.
Okay, so that's all done in the first visit.
So the first visit will be the extraction and the bone graft.
Okay.
And then we wait for the gums to heal over. That takes about 3 weeks to heal over.
Okay.
And then the bone graft heals underneath for 3 months. And by 3 months, you get enough strength for an implant placement. So they come back in 3 months, we do a CT scan, and the CT scan shows us everything we need to know about the anatomy of that region in 3D. Based on the CT scan, I plan the implant, and in the lower back region, we are trying to stay away from the nerve. There is a nerve that goes underneath, and so we're trying to stay away from that nerve. In the upper back region, there is a sinus that we all have, and so we're trying to stay so that the implant doesn't go up into the sinus. So using the CT scan, we are able to measure in millimeters exactly how big of an implant we can put, what height and what width of implant. Then we plan the implant and we put the implant in, which is a titanium screw. We just screw it in and we let that heal for 3 to 4 months. We wait 3 months for the lower jaw, 4 months for the upper jaw, just because of the difference in bone density. So at the end of 3 or 4 months, you come back, and the implant that I put is completely covered by gums at this point. I cut the gums again, and I remove a screw from the top, and I add another piece that sticks out through the gum. We let that heal for 2 more weeks, and then you go back to your dentist, and they will make a cap on that piece that's sticking out.
Oh.
So from start to finish, it takes about 6 to 7 months. But there are certain instances, and this is the key thing, there are only certain instances when I can take a tooth out and put an implant at the same time for certain teeth. And there are certain other instances when we take out all the teeth, put all 4 or 6 implants, and the dentist comes here and makes a set of teeth on the same day. But that's not for everybody. That needs a lot of preoperative planning,
Yes.
but it's possible in certain instances.
Okay,
Yes.
well, that's certainly good to know, Dr. John. So this is something that we're not talking about generally speaking. Again, it depends on each patient, but we're not looking at 2 or 3 or 4 years. You're looking at 6, 7 months, maybe upwards of a year or less, depending on if there's bone grafting required to build up the density, right?
Exactly right.
Before the implants will take.
Yeah.
But that's actually not long at all to get get those teeth back in a manner that I would think, unlike the other options that you've already mentioned a few times, these are permanent.
These are permanent, exactly.
This
right.
isn't some temporary solution. We get our bite back, our smile back, and a lot of times our confidence back.
So when people come to us several years later, either because they could not have an implant done or they had dentures made or whatever the reason, if they came to us 5 years later and the bone is completely gone, it's not the end of the world. It's not like we cannot do an implant. The 2 biggest things that we need to do an implant is enough bone, and the more bone we have, the better a bigger and longer implant that I can put. And the second thing is good soft tissue covering the bone. So if a patient came to me and didn't have good bone, then I have to build bone back up before I need to put an implant. So to build bone up, we can take bone from the chin or from the ramus or from the cheekbone and put it there and put a couple screws on it and let that heal for 4 months. If we need more bone, I can take from the knee a little bit of bone, or I can take from the hip. From the hip, I can get about 5 centimeters of bone, 5 by 2 centimeters of bone, but obviously that's a hospital case. We can take it from the hip, put it in your upper or lower jaw, and put screws on it, cover it up, let it heal for about 4 to 6 months, and then there is plenty of bone so that we can put implants later on. Okay. So there are other options where if the jaw is too narrow, I can split the jaw and open it and let that heal for another 3 months, 3-4 months, and then you have good width of bone. So depending on whether the width is less or the width and the height is less, we have different bone grafting options that we can do to build bone up before an implant is done.
You can literally customize the dental implant treatments from what you just described, depending on each patient and what's needed to get that maximum result.
Yeah.
Now, what other services and treatments do you offer here at your practice, Dr. John?
So we do a lot of dentoalveolar, which is saying tooth and tooth-related things like if a orthodontist sends us a patient that has a tooth basically stuck in the upper jaw and it's not coming down, then we can make a hole in the bone and connect it's called a bracket that we connect to the tooth, and then we send them back to the orthodontist, and the orthodontist basically pulls that tooth down to make it come to the arch. Or if the orthodontist needs to straighten a tooth, we can put a screw in the bone, and the orthodontist uses that screw as an anchor to pull teeth up, to straighten it up for younger people. For our TMJ patients who have joint and muscle issues, we can do Botox at the 4 main chewing muscles and relax those muscles. Or if they have an actual joint problem, we can do, it's called arthrocentesis, where we can go into the joint and wash it out and clear out some of the inflammation causing parts of the joint and give them relief that way. Or if they have their jaws set too far forward or too far back, or either the top or the bottom, we usually work closely with an orthodontist who, and then we take them to the operating room and cut the upper and lower jaws into multiple small pieces and move them either forward or back or sideways or whichever way. We can also do trauma patients who have jaw fractures from either a fight or a fall or whatever. Jaw fractures of the lower jaw or upper jaw or the eye socket. And obviously that is a operating room case. We take them to the operating room, fix the upper or lower jaw or the eye socket or whatever. And so trauma and TMJ patients, and then the usual run-of-the-mill office stuff like extractions and implants and bone grafts.
Now, I find it interesting you mentioned Botox a couple of minutes ago for the TMJ patients, because a lot of times folks out there generally equate the word Botox with a cosmetic treatment, basically to make us look younger, but it's interesting that it is also utilized for TMJ patients when needed as well.
Right, and it's only if the TMJ problem is caused by muscle. And most of the patients that come to me saying that they have pain on the side of their face, it's usually a muscle pain. It's not really a TMJ pain, and we just have to inject the 2 main muscles on either side with Botox, and that kind of paralyzes those muscles for 3 to 6 months, and they have relief, and then they're able to get over the muscle pain.
We're now going to hear from some patients of Dr. John.
I had a broken tooth and an infected molar, and they needed to come out. I had 2 extractions And then I had 2 implants made. Very pleasant. It was almost so pleasant to come here. I had absolutely no fears, felt very comfortable. Just don't be afraid to come here.
We're now back with Dr. John. I must say the patients were very happy, Dr. John. Some great work.
Thank you very much. We talk about it, but we also treat our patient how I would treat my family. And I do the same thing for my dad, which I have done in the past, the exact same thing that I do for my patients.
Now we're literally out of time, Dr. John, but I wanted to ask you before I let you go, you and your practice here in the Towson, Maryland region have certainly established a reputation for excellence. Not only are you one of this area's top oral and maxillofacial surgeons, but your staff, yourself, have an excellent reputation also as far as in the area of patient care. I just wanted to ask you what you feel helps separate you and your practice apart from many of the others.
We have a lot of patients that come here. In fact, 99% of our patients come here anxious and scared, and they say it's no offense to us, but they hate being here. And they come here not wanting to be here. But we have a very caring staff that work with me, and they calm the patient down, and we put them to sleep whenever they need. Most of our anxious patients are completely happy and calm down after they have talked to us. Yeah. Every problem is just a consult away, and they just have to take one consult, and we can go through their customized problem and give a customized treatment plan. The other thing that I think is different is I did my dental school first, and then I did 4 years of medical school, and then I did my residency. So I'm confident, by God's grace, with any patient that walks through the door with any medical problem, any age, and it's not a challenge. I mean, I'm not surprised by any medical issue. The other thing is that we have affiliation with 2 hospitals that if there's any need for me to do a bigger case, like a hip graft or a knee or something, I can always go to one of those 2 hospitals and do those cases. And one other thing that patients have mentioned is that I always give all the options without pressuring anybody to choose one or the other. And that's why earlier in the interview I said that one of the options is to do nothing. And I tell that to every single patient, because that is an option. And if they want to choose that, that is their choice. I give all 4 options or all the different options, and I basically lay out the pros and the cons, and they can choose what they want. If they don't want to choose right then, they are welcome to go back home, read stuff on our website, and call us and let us know what they have chosen, with no pressure whatsoever. Same thing with going to sleep or not going to sleep. If you want to go to sleep, I'll put you to sleep. If you don't want to go to sleep, I don't need to put you to sleep.
Yeah, and those are for those patients that need the sedation component to undergo various treatments or treatment.
Yeah. The only other point that I would make is that we have excellent communication with the patient's doctors. So the referring doctor and me are in constant communication, either email or text or phone, so that we can give the best possible treatment for the patient.
Yes. You really customize your treatments here for your many patients that you've been servicing throughout this region here in the Baltimore County region and beyond. And you know, you touched on it a few minutes ago, Dr. John. Biggest fear that most people have, because you're talking about how so many patients are anxious, right? Nervous, they have a fear. Well, that applies to the whole arena of dentistry for that matter. Yes. That's one of the biggest fears people have. Yes. Literally, it's been surveyed over the years. Yes. It's like literally after death and taxes comes going to the dentist.
It's actually the second biggest fear.
Yes.
The biggest fear is fear of public speaking.
There you go.
Yes.
That's right.
The biggest fear is fear of public speaking, and the second biggest fear is fear of going and having your mouth open because you don't know what they're doing and you can't see it.
That's right. And yet you make it so comfortable for them. You and your staff, you have the sedation option for those that really need that. But because we do need work in our mouths as we go through life, at some point or another, if not multiple times. And if we just neglect it and don't go, then that could lead to some serious problems down the road. So that's why it's so important for folks to go to a dentist, an oral surgeon like yourself, and certainly with what you and your staff offer here, how comfortable you make them. We've talked to several patients. You have really done a great job. You continue to do that each and every day. And on that note, we'd like to thank you, Dr. John, for joining us, educating us, and being a guest on our program. It was our pleasure having you on.
Thank you, Mr. Rocco. Thank you very
We'd
much.
love to have you back on in the future.
Thank you. I hope
Thank
to.
you.